Awesome. Good morning, everyone, and thank you for joining us and welcome to the 11th Annual Family Planning Market Report webinar. We're thrilled to have such a diverse audience joining us today. My name is Lisa Matai, and I'm an associate on the Global Markets team at CHAI. I assist with the Family Planning Market Report efforts in partnership with our colleagues at RHSC. Before we jump in, I'll start off with a few housekeeping points. Firstly, this session is being recorded and the recording will be publicly available on the FP Report website. We welcome everyone to engage through chat, but for any questions, please use the Q&A function specifically. We'll follow up on any unanswered questions after the webinar. And lastly, if English isn't your native language, we have real-time translation available through Wordly. On the next slide, I'll quickly walk you through how to access this. To use Wordly, please scan the QR code or go to the website shown on the screen, select your language of choice, and read the captions on your phone. While everyone's getting this set up, I'll hand it over to my colleague Vidhi to also introduce herself.
Hi everyone, it's great to see so many of you join us today. My name's Vidhi Lohia and I'm a manager on the Global Markets team at CHAI. I work across family planning products and on the family planning market report specifically. Today, Lisa and I will be walking you through some of the key findings from the report, followed by a panel discussion. Before we jump into the content for today's webinar, I'd like to hand it over to Mansi Chatalia to introduce herself and share some opening remarks. Over to you, Mansi.
Thank you, Vidhi. Good day, everyone. I'm Mansi Chatalia. I am a Senior Director on the Global Markets team at CHAI. Thank you all for joining us today. I am delighted to welcome you to the launch of the 2025 Family Planning Market Report, the 11th edition. This report has become a key resource for the family planning community, providing a comprehensive view of how the contraceptive market is evolving across low and lower middle income countries. What makes this report unique is the depth of collaboration behind it. We're grateful to the 18 manufacturers who share data each year and to our colleagues at UNFPA, Avenir Health, FP 2030, and RHSC for their long-standing partnership and for advancing the visibility and coordination that makes this work possible. These contributions allow us to look beyond individual data points and understand the broader dynamics shaping the market, from shifts in method mix to the growing procurement trends and to the emerging pressures countries face as financing becomes more constrained. Before we dive in, it is important to note that this year's report reflects trends only through 2024. The effects of recent funding disruptions, including those linked to USAID's dismantling, are not captured in the quantitative data. We expect these impacts to become clearer in future editions. This year's report highlights both real progress and real challenges. We see continued growth in CYPs, expanding method choice, and strong growth in long-acting methods. At the same time, we are entering a period of greater uncertainty with donor transitions and increased pressure on domestic systems. Today's conversation is about unpacking these trends together, what they mean in practice, and what actions are needed to safeguard access and choice. I'm thrilled to be joined by an excellent panel who will help us interpret these findings from global, regional, and country perspectives. With that, let's get started, and I'll hand it back to Vidhi to walk us through the agenda.
Thanks, Mansi. So, quick overview of the agenda. There are 3 items. The first one is report overview and key findings. We'll spend about 15 to 20 minutes going over this agenda item. The second one is a panel discussion. Again, we'll spend 15 to 20 minutes with our panelists. And finally, we'll save 10 to 15 minutes towards the end of the webinar for any questions from the audience. You can keep putting in your questions in the Q&A box where we'll keep looking at them, and then towards the end, we can raise them for the panelists. In terms of the report structure, there are 4 key sections within the report. The first one being the supplier shipment analysis, which looks at trends based on shipment data the suppliers share with us directly. The second one is the UNFPA and USAID procurement value analysis, which looks at procurement trends from UNFPA and USAID over the last 5 years, as well as provides qualitative commentary on the funding outlook. The third one is domestic government spend analysis, which looks at how much governments have spent over the last 5 years on family planning products in terms of procurement, as well as shares the importance of domestic government financing in the coming years. The final section is a qualitative one, which highlights key findings from our discussions with stakeholders in the space. Next slide, please. A quick overview of the scope for the report. The time frame for the report is 2020 to 2024, and a lot of the analysis is based on data that we received directly from 18 participating manufacturers. You can see their names here on the slide. Our focus is on the public sector market and 7 key modern methods of contraception, including implants, IUDs, oral contraceptives, emergency contraceptives, injectables, and male and female condoms. And finally, we have 85 in-scope countries, majority of which are low and lower middle income countries. Next slide, please. With this, I'll hand it over to Lisa to walk us through some of the key market trends from the report. Over to you, Lisa.
Thanks, Vidhi. So the first section I'll walk through is the supplier shipment analysis. But before diving into the trends in CYPs, volumes, and market value, I'd love to get us warmed up with a quick poll. So the question is, how did the public sector contraceptive market value in US dollars evolve from 2023 to 2024? I'll give everyone a few seconds to respond before revealing the answer. Okay, great. So, perfect. I'll stop the poll there. Thank you all for participating. The correct answer, as most of you have put in, is that the market value grew between 2023 and 2024. Before we dive deeper into these numbers, I want to quickly ground us in the scope of this year's report. As Mansi mentioned, the findings I'll walk through today cover the period from 2020 to 2024, so they reflect the state of the family planning market just before the major funding shifts following the dismantling of USAID. Those impacts are already unfolding, but their effect on procurement and access will only show up in next year's report. So with that context in mind, let's move into the key findings for this year. So we measure the market trends using 3 main indicators. We have CYPs shipped, market value, and market volume. In 2024, across these indicators, we see an overall increase of 7% in CYPs shipped, which refers to the couple years of protection shipped. We see an increase of 5% in market value measured in US dollars, and an overall 6% decline in volumes, largely driven by a significant decline in oral contraceptives procured in Bangladesh. We'll discuss this more in later slides, but excluding Bangladesh, the market volumes actually increased by 4%. So I'll provide a bit of context on how we calculate these indicators. Market volumes are directly from supplier shipment data and are aggregated to maintain confidentiality. Volumes are the basis for the market value and CYP shipped calculations. CYP shipped is calculated using a CYP factor, which is an estimate of the number of units needed to provide a couple with 1 year of protection. This enables a more standardized comparison across the methods, especially for longer acting ones that provide multiple years of protection per unit shipped. And lastly, we have market values that are calculated using the publicly available unit prices from the UNFPA contraceptive price indicator. On this slide, it is interesting to note that the 5% increase in market value is lower than the 7% increase in CYPs shipped, reflecting the procurement of more cost-effective methods such as long-acting ones. On the next slide, we'll focus on the first indicator, which is CYPs shipped. So the data on this slide shows total CYPs shipped annually from 2020 to 2024, and the units are in millions of CYPs shipped. The main takeaways here is that overall CYPs increased by 7%, from 132 million in 2023 to 142 million in 2024. Injectables, shown in yellow, contributed the most to CYP growth, with an increase of 27% from 2023. This was largely driven by increased procurement in Bangladesh, Ethiopia, Madagascar, and Malawi. Copper IUDs, shown here in light blue, increased by 11% between 2023 and 2024, largely driven by cyclical procurement trends. Copper IUDs offer long duration of protection, around 5 to 7 years, so some years countries procure a lot more than others. This cyclical pattern is particularly evident in India, Indonesia, and Uzbekistan. Lastly, implants, shown in dark blue, increased by 13% between 2023 and 2024. 2024 marked a return to growth after plateauing at around 39 million CYPs shipped over the past few years. Next, we'll look at another view of this same graph, honing in on long-acting methods. So the data in this slide is similar to what we saw in the last one, showing total CYPs shipped from 2020 to 2024. However, this time we've split it by short-acting methods in light blue and long-acting methods in darker blue. Here we see that long-acting methods comprise the majority of CYPs shipped in 2024 at 66%, up 2 percentage points from 2023. Next, let's look at the patterns in market value. So the bar chart on the left shows the amount spent on contraceptives between 2020 and 2024. We see that the market value increased by 5% from 288 million in 2023 to 301 million in 2024. The table on the right shows the year-over-year growth by method, as well as the growth over the 5-year period. The methods that contributed the most to growth in market value were injectables, in yellow on the graph, which increased by 27%, and implants, in dark blue, that increased by 14% between 2023 and 2024. The next slide will show a different view of this same graph, looking at the major countries that are contributing to growth in market value. So the graph on the left is similar to the one we saw on the last slide, looking at market values over the 5-year period. However, this time we've split it by the proportion of the market that's covered by the 10 largest countries in terms of market value, which are in dark blue, and the other 75 in-scope countries in gray. In 2024, we see that the 10 largest countries represented 59% of the total public sector market value. Moving on to the bar chart on the right, we have a view of which specific countries are part of the top 10 markets. In 2024, Ethiopia surpassed Bangladesh as the top market with 9.2% of the market value. Between 2023 and 2024, the rankings remained largely stable, with Zambia and Madagascar entering the top 10 and Tanzania and Ghana dropping out. So the last indicator we'll discuss is market volumes. The bar chart on the left shows market volumes excluding male condoms from 2020 to 2024. The reason we've excluded male condoms is just because of the sheer magnitude in volumes that would skew the overall trends. However, we've provided male condom volumes on the table in the bottom right. Overall, volumes decreased by 6% from 2023 to 2024, driven by a decline in oral contraceptives in Bangladesh, which outweighed increases in injectables, implants, female condoms, and copper IUDs. If we look at the combined and progestin-only orals, which is in dark green on the slide, we see volumes declined from 182 million to 137 million, which is roughly a 24% decline in procurement. Bangladesh was the main driver of this decline. The graph on the top right shows a different picture of market volumes between 2023 and 2024. We see that when we exclude Bangladesh, volumes increased by 4%. So these trends in market volume highlights the outsized influence of Bangladesh in shaping global procurement patterns. The other driver of reduced volumes was male condoms that declined by 23% from 1.7 billion in 2023 to 1.3 billion. This decline reflects a reversal back to the 5-year average at around 1.3 billion. So we have another quick poll before we dive into the next section, looking at UNFPA and USAID procurement values. And the question is, how do you think UNFPA and USAID's procurement values evolved from 2023 to 2024? Okay, great. Yep. I'll end the poll there and reveal the answer. Okay, thanks for participating, everyone. So I see most people did actually choose the correct answer, which is that UNFPA's procurement increased while USAID's procurement declined. So let's firstly look at UNFPA's trends. The data for this analysis is collected from the UNFPA Supply Chain Management Unit. The graph on the slide shows UNFPA procurement values from 2020 to 2024. Program procurement is in dark blue. TPP, or third-party procurement, is in light blue. Third-party procurement refers to procurement carried out by UNFPA on behalf of governments using their own domestic resources, which enables countries to leverage UNFPA's pooled purchasing and negotiating power to access affordable, quality-assured commodities. The main takeaways here is that between 2023 and 2024, UNFPA procurement increased by 4% from $178 million to $186 million, which is the highest procurement value during the 5-year period. TPP accounted for 25% of total procurement, up 1 percentage point from 2023. This reflects continued growth in domestic and co-financing arrangements. Next, we'll see how USAID's procurement trended. So before we look at the USAID findings, I want to note a key update to the data used for this analysis. In previous editions, we relied on USAID's Overview of Condoms and Contraceptive Shipments report, published annually for values on USAID procurement. With the dismantling of USAID, this report was not published this year and will not be released going forward. So this analysis was updated to use data from RHVIS, or Reproductive Health Supplies Visualizer, for all the years. RHVIS is a publicly available database that provides visibility into historical procurement shipment data, as well as live procurement shipment data from the global FP van. Note that we've excluded condoms since it's hard to isolate condoms procured for family planning versus HIV. The main takeaways here is that USAID procurement declined by 25%, from $55 million in 2023 to $42 million in 2024. However, the $42 million reflects a return to more typical funding levels following unusually high spend years in 2022 and 23. The increase in 2023 is attributed to the receipt of special funding flows for commodity procurement through the Congressional Notifications Funds, which is separate from the usual core funding. And the increase in 2022 was driven by additional funding made available by USAID based on gaps identified by the VAN Consensus Planning Group. And next, we'll look at the broader funding outlook following the major shifts this year. So estimates from analyses by RHSC and community members across 48 UNFPA supplies partnership countries found that unfunded FP procurement needs for 2026 amount to $288 million. Firstly, let's look at the UNFPA funding outlook. UNFPA supplies funding is under strain due to US withdrawal and other significant donors, including UK, France, Germany, and Netherlands, having announced plans to reduce ODA. Allocations for family planning commodity procurement have already decreased by 12% in 2025, and a further 5 to 7% reduction is expected in 2026, with allocations projected to remain at this lower level through 2027. So turning to the USAID funding outlook, the dismantling of USAID is expected to create an additional funding gap of $62 million annually for commodity procurement, including USAID's support of condoms. USAID was also providing a lot of programmatic funding to countries, so factoring this in brings the additional gap to larger than $62 million. So the full impact of USAID's dismantling is expected to materialize fully in 2026 and beyond. But in the meantime, if you want to learn more about the impact of USAID withdrawal, we recommend reading these two memos. These memos were published in June and November by CHAI and RHSC to start tracking the effects of USAID's dismantling. They also highlight the efforts countries are making to mitigate these challenges. One of the key areas that will be crucial is domestic resource mobilization, which brings us to our next section. So before diving into the findings on domestic financing, I'll provide a bit of context on the data sources we used this year. So in previous editions of the report, we leveraged three complementary data sets, namely USAID's Contraceptive Security Indicator Survey, UNFPA's National Budget Allocation and Spend dataset, and Track 20's Family Planning Spending Assessment. This provided a comprehensive view of contraceptive commodity spending across more than 65 countries. USAID's Contraceptive Security Indicator Survey is no longer available following the dismantling of USAID, and Track 20 data was not published this year. Therefore, this year's assessment relies on UNFPA's National Budget Allocation and Spend data, covering 54 UNFPA supplies partnership countries. Due to data sensitivities and the reliance on a single source, this year's report does not present country-specific insights, but we will in future iterations since Track 20's FPSA data is expected early next year. Before diving into the trends, we have our final poll. So, how many of the 54 UNFPA supplies countries reported more than $1 million in domestic financing in 2024? Okay, so we're seeing a range of responses here. Okay, I'll end the poll there. I think I ended it at 46% said 12 countries, which is the correct answer. Thank you for participating. So just a bit of orientation to the slide. We have the bar chart on the left that shows domestic expenditure across the 54 UNFPA supplies countries from 2020 to 2024. We see that expenditure increased by 34% from 39 million to 53 million. The year-over-year increase and the longer-term trend underscore that domestic financing for contraceptives is on a sustained upward trajectory. So in addition to increasing expenditures, we're also seeing a growing number of countries executing their allocated budget. In 2021, we had only 4 countries spending at least 80% of their allocated budget, and this grew to 23 countries in 2024. This upward trend indicates better planning, stronger management of FP budgets, and a growing ability to execute funds efficiently. The table on the right shows the distribution of countries by spending levels from 0 up to the highest band, which is 5 to 10 million. We see that majority of countries fall in the lower spending levels. Only 12 countries spent over $1 million and 6 spent over $2 million. Notably, the trends in per capita spend do not always align with trends in total government expenditure. Several countries rank among the top spenders in absolute terms, but fall into the lowest ranges per woman spending brackets. This highlights how even substantial national allocations can translate into relatively low per woman spend in populous countries. So looking forward, the role of domestic financing is becoming more critical than ever and sustained contraceptive security will increasingly rely on stronger domestic financing commitments. This brings us to our final section on stakeholder discussions. So I'll briefly highlight a few priorities that came up in discussions with stakeholders. As discussed on the last slide, stakeholders emphasized the urgent need to strengthen domestic financing and diversify funding sources. They also highlighted that stronger commercial sector engagement will be essential to maintaining access and method choice as public resources become more constrained. Finally, stakeholders reiterated that continued collaboration and data visibility across the community will be critical to advancing sustainable and equitable total market approaches. So I'll stop there, but the report goes into a lot more detail than this on key strategic priorities moving ahead. So this brings us to the end of the key findings. Thank you everyone for your participation and attention during the presentation. One additional note is that we're always eager to collaborate with new suppliers. And if any suppliers on this call are interested in joining the report, you can reach out via the website or the contact details on the slide. I'm now going to hand it over to Mansi to introduce the panel and moderate the discussion.
Thank you, Lisa. So I will start out with the panelist introductions. We first have Caitlin Glover, who's the Vice President of Women and Newborn Health Programs at CHAI. We have Alexis Heaton, Senior Manager at RHSC, Rosemary Kihoto, Senior Deputy Country Director for Kenya at CHAI, and Jason Bremner, Senior Director, Data and Measurement at FP 2030. We also have Martin Smith, who will be supporting us with the Q&A and closing remarks at the end of this session. He's a director at RHSC. With that, I will transition us into the Q&A. So as we heard from Lisa, the report highlights continued market growth between 2023 and 2024, with CYPs up 7%, market value up 5%, and increased procurement for LARCs and injectables. However, it also discusses the challenges and uncertainty in 2026 and beyond, following the dismantling of USAID and the decline in ODA. It's probably going first to Caitlin. How do you see countries responding to this combination of a growing market and a tightening funding environment? What's changed in the last 12 to 18 months? Can you also shed some light on the domestic financing and commercial sectors? What are the roles of different stakeholders in this space?
Thanks, Mansi. Thanks for that question. I'm happy to speak to that. I think what we're seeing across countries right now is this very real tension between a family planning market that continues to grow in scale and sophistication and a funding environment that's become significantly tighter over the past 12 months and will continue to be restricted. And so I think what we see across countries is governments are facing this intense budget pressure from multiple overlapping crises, and they're being forced to make difficult trade-offs. I think one of the things we've been trying to do at CHAI is to really closely track the impact of the USAID dismantling through our market impact memos that Lisa referred to, which draw directly on country reported data. And through those memos, I think we've seen that countries are at risk of national stockouts across multiple methods. We're seeing that countries are experiencing declines in consumption with some decreases as high as 60%. At the same time, I think we've also seen these encouraging signs of donors and governments mobilizing quickly to help address the challenges, but the gap remains enormous. If you take Uganda, for example, it's a country where we saw 73% of facilities reported some level of service disruption after the USAID stop work order, with family planning being among the most affected services. And we actually saw this drop of 10% in the number of CYPs that were dispensed between 2024 and 2025. Now, what was encouraging in Uganda was we saw the government able to secure supplementary funding for contraception and actually doubled the reproductive health commodity allocation. but the country still faces this funding gap of over $16 million. So it's this mix of both resilience and encouraging response from governments and donors, while also still grappling with the realities of the size of the challenge that we all face. Monty, you asked about the commercial sector. And I think when it comes to manufacturers, what we're hearing is that they're grappling now more than ever with unpredictable donor funding, which complicates their production planning and pricing. What they're asking for is clearer forecasting, more coordinated purchasing, and better visibility into those domestic financing trends. So I think when I think about what we're seeing in countries and what we're hearing from manufacturers, there are two things that I think about that we really need more of going forward. One is collaboration, which I think this report is a great example of the community's collaboration. It's a real strength of the family planning community. This market dashboard, the VAN data, FP 2030 metrics, these are all collective assets. They only exist because manufacturers, donors, governments, and partners are willing to share data and insights. So I think that kind of continued collaboration across stakeholders will really be essential to navigating this moment and protecting access and choice going forward. And then I think the second thing I think about is the need for a total market approach, really as a strategic imperative, something we've talked about for decades, but it is so crucial at this moment. CHAI recently convened Ministry of Health officials from across a few countries, Ethiopia, Kenya, Nigeria, Uganda, and Zambia. I think one message that was consistent across countries was that governments are craving this whole market visibility. They want better data on private sector volumes and prices, smarter regulatory and pricing levers to attract investment, and clearer mapping of cross-channel flows to reduce leakage and crowd out. They're really eager to leverage the private sector to achieve their contraception goals, and I think that's a key imperative as we move forward. Thanks, Mansi.
Thanks so much, Caitlin. Moving on to Alexis. Alexis, what are you seeing in terms of funding gaps and procurement risks across countries as we head into 2026? And what is needed from a data visibility and coordination perspective to manage these risks as we move into 2026?
Great. Thank you, Mansi. Great question. I'll start with what we're seeing in terms of funding gaps and procurement risks, and then turn to what's needed from a data and coordination perspective. On the funding picture, I think as Lisa covered, gaps have widened sharply this year. To put in context, over the past 5 years, total donor funding for family planning commodities has averaged around $250 million annually. USAID was responsible for about a quarter of that, roughly $62 million per year, including condoms. With USAID's withdrawal, we were fortunate to have some procurement that was already en route, and many affected countries had buffer stock, which has helped to mitigate some of the immediate impact this year. But the uncertainty extends beyond USAID, and it extends beyond this year. We're watching closely as other donors assess their commitments to family planning in 2026 and beyond. So looking to 2026, the picture is concerning. In September, the VAN assessed the funding outlook for the 48 of the 54 UNFPA supplies partnership countries. Unfunded needs stood at around $288 million. Known commitments at that time, including UNFPA supplies' approved 2026 budget, totaled just $159 million, well below the historical average. That need will have to be filled by governments, NGOs, and other partners to avoid stockouts in 2026. So it's obviously, something we're very closely tracking, looking, and concerned about, continuing to watch that space and see how those gaps and other commitments are made to help ensure that we don't have stockouts in 2026. On data visibility, this is where I do want to flag another critical risk. Beyond product procurement, USAID supported supply chains and system strengthening, including data systems, and in many countries, the forecasting and supply planning process that depends on that data and those data systems. the loss of that could create real blind spots for us in terms of how we're looking at the needs and understanding where products are most needed. At RHSC, and through the work of the Visibility and Analytics Network and its network of member countries, we're working to maintain visibility, but this transition poses risk to both data quality and timeliness. This matters not just for tracking stock levels, it's essential for understanding how demand is shifting. As Caitlin talked about, this changes in service delivery and where products are being used in that lessening in consumption. Without understanding those changes in demand, we can't ensure that funding is going to where it's most needed. So that data visibility is really a huge part. So in what we're doing on that, through the VAN and the Consensus Planning Group, we're continuing to work directly with countries to update and share supply plans. This remains the best way for them to make their procurement needs visible to the global community of donors and other partners working to mitigate those risks. In 2025, our country analysts work very closely with national counterparts to track supply risks, as well as other supply chain bottlenecks, to help ensure that products that were en route were able to be distributed and prioritize additional funding as possible. We're also working to ensure that the VAN offerings continue to meet country needs in this changing landscape. So looking ahead, making every dollar stretch further is now more important than ever, and key to that is ensuring data visibility, promoting better data sharing and coordination, and providing a neutral forum to drive collective action. We'll continue to support countries, procurers, donors, and other partners through the VAN to ensure that they have the data they need and the platform to raise supply issues. And beyond that, RHSC is building a broader data platform, a broader community-wide analysis space that will bring together other data sources to generate new insights to reproductive health supplies and to streamline access and analysis. So really helping to try to, within our contracting data space, trying to bring it together and make sure we have greater sharing and visibility. But the bottom line is this: the funding gap is real, and the data challenges are significant. But I think, in thinking about 2025, and while this year was a shock to us all, it's a moment like this that can really change and accelerate new ways of working, whether it's greater domestic financing, more efficient coordination, and innovative ways of pooling resources and sharing data. So while I think we're all still reeling from what happened this year, I am cautiously optimistic that out of this, we will come together and have a more resilient system following. Thank you.
Thank you, Alexis. We will move to Rosemary. Rosemary, this question is for you. We heard about the funding gap across countries. From your perspective, how is Kenya navigating this complex funding environment at the country level?
Thanks, Mercy, for that, and for the prior speakers. I think it's important that we discuss the funding landscape in three ways, because our experience has been very different across 3 seasons. We have the pre-COVID season, then we had a season when the government and donor partners in the country came together and signed onto an MOU that would see government transition to fully domestically funded FP commodities. And then, of course, there's a post-COVID season that came in with its own shakeups in the sector. But before we do this, I think it's important for us also to understand or appreciate what constitutes perhaps the financing need before we discuss the gap. And it's essentially a country looking at what their total need for family planning commodities would be if we were to meet that entire need. Secondly, it's to look at the method mix that is available in that country. And of course, how this plays in is the fact that some commodities will introduce, perhaps will not be priced at the same pricing point as the other products we had before. Sometimes we'll see a shift in pricing overall downwards across the different commodities. And then, of course, you might see a few products perhaps reducing in terms of volumes and others going up. And so it's very important that there's visibility in these trends. And of course, having real-time forecasting and quantification across the entire method mix, so that at any one time, there's good advice and guidance to government in terms of what they need in volumes across the method mix, and then cost it. Secondly, it's looking at where are services offered. So there's a total need for the country, and there's where the services are offered. And in our context, I think across the method mix, what we've seen is over their products, except for pills, every other product is at over 65% being offered in the public sector. Some like implants at 86%. And so it's very important to recognize this split of where the service is offered. And maybe later on we can discuss how the commercial sector comes into play to help offset some of the shocks we're experiencing in the space. And so having those three in mind, I'll take us back to our 3 seasons. One, the middle season was a season of hope, but we've not given up. So pre-COVID, we had a situation where we had forecasted and quantified our need as a country and costed that. Also looked at the funding landscape and looked at where the funding was coming from at the time. And what I can say is that we had about 53% of that need being met at the time. Only 20% of that met financing need was coming from government, and donors were contributing to the rest. Hence the conversation around how we could work together with government to gradually transition the financing of family planning commodities to 100% to government by the year 2025, 2026. So I'm talking about conversation started in the financial year 2017 to 2018, and then the MOU signed in the financial year 2019, 2020. And we saw government honoring that commitment by not just allocating the resources, but actually disbursing those resources to the FP commodities, because there's a difference between those two. We don't have enough time to go into that, but there is a commitment and then there's a disbursement. And in the year 2019-2020 financial year, we did see a huge jump of first what was funded of the annual need, jumping from less than 60% to 80%. And what was amazing about this season is that we saw government contribution jump to about 58%. Close to 60% of what was needed in the country was being financed by the government of Kenya. And then COVID kicked in the early months of that financial year. But of course, we felt the full shock in the financial year 2020-2021. And I think we all appreciate what happened then. A lot of resources redirected to respond to the emergency then, which cut across several years. And I believe even now, the issue is around, can we also allocate more resources to prepare countries for any other emergency? So the needs have increased in terms of what government should cover for. So there was a window of hope there when we were seeing that transition actually actualizing, with government putting more and more of their resources into this into the FP commodities and honoring their part of commitment in the MOU. Post-COVID, of course, I think it's not just government. Obviously, it was naturally expected that would fully transition out of donor support by this financial year, 2025-2026. So 0 contribution by the donors and then 100% uptick by the government. But what we've seen across the two partners, government and the donor partners, is of course a reduction and a decline in their contribution. So there are donors, of course, who have appreciated the situation and the circumstances that the government found itself following the COVID-19 pandemic. And so extended the agreement to this period, which is the current financial year. However, we've seen a decline in terms of what that contribution is. And of course, a decline in government contributions. Today, I think we sit at 56% of our need currently is funded. And about 32% of that is coming from government. We're not where we are when we started off in 2020, so still better than the 19%. But then again, as we said, we are working in a space where countries are still dealing with what they had to invest to respond to COVID. But at the same time, our macroeconomic space has had its own shock. There's rising debt and more commitments and more priorities for our government to honor. And that has impacted basically all sectors, not just the health sector. And I think, of course, we also appreciate the fact that this year also came with its own shock. And I would say, part of our commodities like condoms were funded under, largely funded also under the HIV program. But I think there's renewed hope that maybe some of those commodities will get covered with this new compact. So that's where we find ourselves. And I think I touched on the commercial sector and what role the commercial sector would play. Today, I think I have highlighted that they're playing a big role in the pills market. If they were to help offset the gap that we see today in financing, a few things have to change: the cost of the product, and then, of course, just regulation, because the markups are extremely high. When a product like implants is going for 40 cents, but the service costs over $100, then that delta is too high for us to even begin thinking of the commercial sector playing a big role. Let me stop there.
Thank you, Rosemary. So probably I will move on to our last panelist for today. Jason, this question is for you. How do the supply side trends in this report line up with what FP 2030 is seeing on contraceptive use and demand across countries? And what does this mean for financing system readiness and the kinds of country commitments and data systems needed to sustain and track progress?
Thanks, Monty. And thanks to my fellow panelists and Lisa for presenting the results. I've had a chance to collaborate on this report for the last decade. And I think what we've seen over time is greater visibility on data into the supply side, and at the same time, greater visibility to contraceptive use. And this year's FP 2030 measurement report, it showed that continued progress. Now, it was, like this report, a look back in time. It was a look back to 2024. Of course, we published it this year, but all of the data that are going into the report are really coming from data sources collected prior to all of the disruptions that have been discussed. And so we really were in a season of progress and hope, as Rosemary had said. We can say that today there are 101 million more women using modern contraception than there were in 2012. We are approaching almost 400 million users of modern methods of contraception across low and low middle income countries. So talking about demand, the demand has been growing. It's been growing because, one, the population of women of reproductive age is growing across almost all of these countries. And two, the percent of women who want to use a modern method is also growing. You put these two together and you have increasing commodity needs, increasing costs, and of course, the systems up till now have kept up. At the same time, we see more choices for women and their partners, and we have seen an incredible growth in long-acting reversible contraceptives, particularly implants and injectables. But let's just talk about implants. In 2012, when the FP 2030 partnership began, implants were the most common method in actually no country across those 85 low and low middle income countries. Today, that has changed drastically, and we see incredible growth in the use of implants, and it's become the most common method in many countries across sub-Saharan Africa, and the second most common method in many more. So this progress continues. It has continued, and countries have kept up. We've seen the number of users double or even triple over the last decade in many of the lowest income countries, particularly in West and Central Africa and some in East and Southern Africa as well. So that's the sign of progress and hope. But this year's report, our report, and this report will look back in time. And fellow panelists have talked about the financial cuts of 2025 that are putting all of this at risk. KFF, another partner in data reporting this year, showed that 80% of funding for donor government family planning, or donor government funding for family planning, 80% of that has come from governments that have announced cuts to ODA. So all of us are saying, okay, the impacts are coming. How will we know it when we see it? And I can tell you that our report will be slow to capture that. And why? Well, you have to actually, with many of our data sources, go to surveys, ask women what they're using, and can imagine that takes time to capture that. It takes time before, we're not seeing real-time data coming from these. These are surveys that are collected periodically in countries. It'll take a long time to capture message shifts in use. So where else do we look? And I think this report is a great place to start. Signals from the shipments are critical, and signals from health systems, what they're delivering, are critical. And we have to put this all together. So I can capture the demand side sort of after I've learned from women what they're using, but the supply side is the early signals of impact. And so we'll be looking together with all these partners, this report, other sources of data, to try to put that together and understand the supply side impacts, and ultimately try to see later on, albeit with some data gaps that I think we need to discuss, the impact on use further down, and potentially message shifts. As my panelists have said, we have to shift potentially, and governments shift toward less expensive methods as they have to procure from their own resources. So this collaboration, as Caitlin said, it's a partnership. We have to do it together, and we're going to have to be really careful to look for these signals of impact over the coming years. And it's not just going to be 1 year; it's going to be probably multiple years of doing this. Thanks.
Thanks, Jason. I do recognize that we're running up against time. So instead of summarizing what all the speakers have said, I will kind of just emphasize one thing. I think there is a collective recognition of the need for data across a number of different sources, and really trying to collaborate as a community to ensure that we are making the most of resources and information that is out there, so that we can help inform actions by different stakeholders to maximize, to continue to maximize access and method choice going forward. And with that, I will hand it over to Martin to take us through Q&A.
Thanks so much, Mansi. Very well summarized indeed. And when we asked you to register for this webinar, we gave you the opportunity to pose some questions to our panelists, and we've got some really good questions here. I'll blend them with a couple that I've seen in the Q&A also. And the first one really does sort of speak to some of this tension that Caitlin and others were taking us through of growth, of scale and sophistication of the market, and yet these funding challenges. And it's a nice forward-looking question, and so I'm going to put it to both you, Caitlin, and to you, Alexis. This question is: what is one thing that you're excited about right now that's happening in the family planning space? So over to you first, Caitlin.
Sure. I think I feel like Alexis, where just energized by what I'm seeing some of the responses in countries with governments and donors really coming together and mobilizing additional resources. It's not enough, but it's a great first step, and it's so encouraging to see that. And I think I'm excited to see creativity and new ideas and new ways of thinking about how we do procurement and how we relook at the prices that we've accepted now for the last 10 years and think about what are new ways of moving from this world where we've had two large global procurers to one where we have maybe more domestic procurement and so on. And so I believe in the community's creativity, and I'm excited to see what comes of this.
Thank you, Caitlin. We always find a way, I think, is a strong message coming through from you there. Over to you, Alexis.
Yeah, thank you, Martin. And likewise, I mean, I think it is a moment where, unfortunately, a crisis has come along, but it really does create the imperative for working together in new ways, and it does accelerate innovation and sort of the necessity to find new ways. And I think, better engagement of the private sector, better making sure that we're looking at total market, really looking at ways to ensure that women get what they need, and with taking on new approaches to improving data visibility, and how do we use technology and all of that to fill these gaps and really accelerate progress, and working across all of us to do that.
Never let a good crisis go to waste, to summarize your point there, Alexis. Excellent. Thank you so much. So, Jason, you took us through very well. I think, the impact of this will be seen over a longer period of time. What's one thing that you're particularly interested to know the impact of that you think is going to emerge in the next 2 or 3 years, based on the data you're seeing at the moment, Jason?
Thanks, Martin, for the question. I think Rosemary sort of hit it on the head of looking at the cost of methods and the potential for countries, procurers, to make somewhat hard choices. I think we've had the luxury of looking at the market and saying, wow, there seems to be an opportunity for implants. And those have been largely procured by donors. Even in a space where domestic procurement is growing, we have a lot of countries that really depended on procurement from donors for emerging methods. So you want to get a method out there. Self-injection is another example, largely procured by an external party. Now, what happens when you have to make choices about cost?
Tough choices,
and will we start to see a decline in choice because we've got to ensure that product is there? Product being which product, at what cost? And so I think we've really being sensitive to that cost and how it affects the market and people's use is something that we really have to pay attention to over the, I would say, next 5 years, because implant is there for 3 years. Let's say you have decide to want to have pregnancy, have it removed. Is it available to you when you go back for that next use? Something we have to look at.
It's a fascinating point, Jason. Just given how dearly we hold the point on full method choice, this is going to be something we're going to need to track very, very closely and carefully. Thanks, Jason. Rosemary, a very quick question for you. How are countries reorganizing internal resources to build resilience? You gave us a bit of the view on that from Kenya. Over to you.
I think there are many shocks that countries are today dealing with, and so that table is crowded with a lot of priorities. And so the first thing that most programs at the country level are doing is really to get a seat on the table, get to be heard, get to be on that priority list. I think in Kenya, what we appreciate is that family planning commodities are considered strategic commodities. And so there is an allocation that is expected from the exchequer, but if that has reduced, then there's still a place for advocacy. And we do have some strong advocates, whether they're lawmakers, government technocrats, and other players from the NGO and civil society. However, I think there's also a place where we've seen innovative financing mechanisms coming in where, or maybe let me say optimizing perhaps some financing mechanisms that were there previously, currently being restructured, like our social health insurance, where we need to basically continue to provide visibility to government on what the entirety of providing FP commodity means. Secondly, it's looking at newly enacted laws that favor autonomy for financing for facilities, the facility improvement funds. How do we get facilities to, one, yes, secure their needs for their operational needs, consumables needs, but at the same time, perhaps start prioritizing on some of these commodities.
Great, Rosemary, thanks. And really having that decision making at local levels to respond to local needs, an absolutely crucial point. So, two quick questions in the chat. The point on the need for further private sector data, the contraceptive social marketing, social business report, and beyond. I think Jason or Alexis are maybe answering that just right now. And then Andrew, your question on regional manufacturing, we couldn't agree more. There's a huge amount of work happening here, but we need to be very realistic, I think, about the long time frames that we're working on here. It requires significant investment. It requires a long road with careful steps and great patience. But we do see regional manufacturing as a key part of this emerging landscape, this evolution, this change that all of our panelists have been speaking about. So with that, Mansi, Vidhi, Lisa, just a couple of concluding remarks from me. I really realize we're at 9:04 a.m. Eastern time. So this is the 11th FP market report that I've been involved in. It's an invaluable resource, and I hear this repeatedly from members of our community, and it continues to evolve. And I think you'll see an evolution of this report as we go forward, given the great change that we've seen. The 2025 report that we'll talk about in December of 2026 is going to be a seminal report. The actions that we have taken together in 2025 and we will take in 2026 are crucial to the new supplies landscape that we're building together. And I would say to you, you should act as if the future of our sector relies upon you and your actions, because it really does. And with that, I'd like to thank everyone profusely for this webinar. To Lisa, Vidhi, Mansi, and to Alexis, Caitlin, Jason, and Rosemary, our panelists. Thank you so very much. All of these resources online, much more data to come. Please continue to engage with us all as we take these crucial actions together to build that stronger future that we're all thoroughly committed to. With that, thank you so much, everyone. Enjoy the rest of your day.